projection, yeah.
yes, very
So
nice.
yeah, so there is a greater occipital nerve which is 2.5 centimeters from the external occipital protuberance. But usually I don't go for measurement because they can be slightly here and there. The lesser occipital nerve is 5 centimeters from the midline. But as I'll show you in my presentation, that we always go with clinical. I press certain points from where these nerves are coming, and patient tells us that yes, my pain, this is exactly my pain. You are reproducing my pain. And then this pain sometimes refers to, like in her case, this pain is also going into her ear, inside the ear. So there is a sensory branch of the facial nerve. So she is having referred pain in the ear, having referred pain in the left eye as well. In advanced cases, many times we have seen that patient also complains of pain going into the face from these headaches. So we will just make this patient sit on a chair so that she can bend forward and we can palpate her bony landmarks, and then we can do. Otherwise, the simple thing is palpate the external occipital protuberance and the mastoid, and one third of medial and one third lateral are the locations of the greater and lesser occipital nerves.
So you said that one third lateral and one third medial, meaning
Yeah, so say this is the, are you seeing my arrow on
yes,
the
yes, we
laptop?
are,
Yeah.
yeah, we are visible.
So from here to here, from the mastoid process,
Right.
you know, this is one third and then two third. At
Okay.
one third of this distance
Okay. One
will
third
be
of
greater occipital nerve,
one
and
third
then
from the greater
from the,
occipital
yeah,
protuberance.
yeah, and then two third will be the lesser occipital nerve. You get me?
But it is the point of
See,
injection
point
that
of
we
injection will
understood.
be here. In her case, this will be only here because she is
In
not having pain in
at
lesser
a
occipital
line
nerve.
which is uh, parallel to the greater occipital
Yeah, yeah.
protuberance.
Yes. So you see here there is this nuchal line,
Yes,
inferior
yes.
nuchal line. There will be a depression. You will feel that, and when we press, the direction of your pressure is mostly 45 degrees, and that's where the patient feels severe pain.
Okay.
Because the idea is always to reproduce her pain, any patient's pain. So, and then we did it nicely. I have also done a video recording of that, which we can show. But
So today, Dr. Mahinda, you will be showing in prone position, or you
no,
can
no, sitting position is
sitting
okay.
only
Yeah,
use.
yeah, yeah. Sitting is okay. We don't need, so just a chair is required. Basically, it's not even a theater procedure.
Okay, okay.
And that's why, you know, the beauty of these headache blocks is that you can do it in, you can do many cases in a single day. Patient gets a fantastic relief and a long-term relief. And I've got so many happy patients now. So, and you can do it all within 10-15 minutes. So, it's a
Very
very
nice.
rewarding procedures. Yeah.
Correct.
Can we make a sit there quickly? So I wish we had more migraine cases where then, because now I don't want to push several points and they are not very difficult. The thing is that, you know, for a neurosurgeon's caliber, these cases are too simple cases and we
Yes.
don't want to do them.
No, definitely. I think this is the first time we are having this workshop, so we
Yeah, yeah.
try to get
And
different variety of.
yeah,
Next
so
time we'll have
because
more
an
cases for you.
occipital nerve is one of the most common trigger points, and this trigger point in her case can be handled later on if we don't know right now what kind of pain relief she will get, what duration, because there is some problem deep inside. Then we can either go for a neurolysis or we can go for ganglionotomy or ganglionectomy at C2. So
And what do
all
you
those things
inject?
are. So yeah, injected we are using usually Xylocaine 2%. But Xylocaine with adrenaline usually is very acidic. So I use for say if I am using 10 ml 10 cc, though she doesn't require, she requires only 3 ml. So 9:1 ratio, we also use soda bicarb 8.5%.
Acha,
So
so
in this case I would be using maybe 3 cc of Xylocaine, zero point 0.5 to 1 cc of bupivacaine, and Xylocard and steroid also, Kenacort or Triamcinolone, whatever is
sorry, can
available.
you repeat it? So for this case, you will be 3 ml of
3 ml Xylocaine,
3 ml
yeah,
xylocaine,
yeah, 0.5 cc of bupivacaine,
bupivacaine,
yeah, Then 0.5 cc of soda bicarb
0.5 cc of soda
and
bicarb.
triamcinolone.
And triamcinolone.
Triamcinolone, yeah.
Okay.
So
All
that
these four
the
drugs you
steroids.
mix together.
Yeah, yeah, we mix together.
So
Yes.
logic for using soda bicarb is to make it alkaline.
No, if anyone has injected himself xylocaine, any experience? I did once for my viral wart and I got such a severe pain, and then I researched about it. If you slightly warm xylocaine, then it becomes painless. That's one thing. Second thing is you can mix soda bicarb, so it neutralizes the severely acidic xylocaine with epinephrine. And there
Okay.
are papers for that.
Okay.
Yeah. Okay, so let me prepare.
Sure.
Can we have gloves? Okay. आराम से हो आप. इतना कुछ लगाने की ज़रूरत नहीं थी वैसे. थोड़ा सा नीचे करेंगे सिर को. कितना नीचे कर सकते हैं? Gloves? Yeah. What about mixing? Yeah, just prepare.
So
Just a
Mahinder,
second.
you have already prepared your this cocktail.
No, no, we've not. Because you started ragging me.
No. Some resident can start preparing it.
Yeah, I just said. So just like 5 cc. We don't need. I'll need spirit swab also. Do we have a marker pen? Marker pen. Not required. Not required.
Mahinder, there's a comment in the group that few studies use ascorbic acid. Are you aware?
No.
No.
But soda bicarb is anyways handily available.
Yes, that is true.
Yeah. So where's the marker pen?
So this you are marking the external occipital
Yeah,
protuberance.
yeah,
And we are doing on the left side.
on the left side.
Right.
Left side ही पेन है ना आपका?
Always better to reconfirm.
So in Kenya, usually we are lucky because most of the patients do not have enough hair.
Huh.
So if
So
we
second
make
point, your
a-
mastoid, right?
Yeah, second point is mastoid. So if you see here, this is coming to be 1/3,
Right.
but then there may be anatomical variations, and this is the 2/3. So this point and this point, yeah.
So
Are you able to see that?
yes, at the level
Because
of the
of that.
superior nuchal line you will make.
Yeah, yeah. So I'll press.
Acha, you'll press and see the trigger point.
यही है दर्द? आप बताओ कहाँ पर दर्द हो रहा है? जोर से बोलना. यही हो रहा है ना? और ये दर्द आपका आगे आंख में भी जा रहा है. कभी कभी आपने बोला कि आंख में भी जाता है पेन. कभी कभी जाता है ना. अभी दबा रहा हूँ तो कान में. कान में अभी नहीं हो रहा. नीचे हो रहा था. एग्जाम जैसा हो गया. थोड़ी देर पहले भी हो रहा था. ठीक है. और अभी आपने बोला कि आपको 7 का वो है ना? अभी आपको जो मैंने स्केल बताया था उसमें आपको 10 में से 7 हो रहा है अभी पेन. ठीक है. स्पिरिट्स में या डिड वी मेक अ मिक्स? ज़ाइलो कार्ड है 3 cc ले लीजिए. एक सेपरेट प्रिपेयर करना है Xylocard only, हाँ, 2 cc and 2 cc distilled water. So one of the peripheral block which I was saying about her C6 is because in the dorsal root ganglion there are pseudo bipolar neurons.
Sorry.
Pseudo bipolar neurons.
Right.
And so if patient has got pain because of a toxic annular tear or because of some compression, the pain is going centrally and is also coming peripherally, which is perceived as pain in the local dermatome. If you block those peripheral nerve endings, it has got a soothing effect in the central nervous system also because of this nature of pseudo bipolar neurons.
Okay.
So it gives a wonderful relief to the patients even with symptomatic disc compression, particularly if you are seeing some, something called as chemical neuritis, which comes because of toxic annular tears, and the nucleus is releasing toxic chemicals like interleukins. Yeah, we are ready. This is what I wanted. Yeah. Do we have triamcinolone also, or even dexamethasone can do? Any steroid will be okay. Triamcinolone sometimes just becomes. We are using triamcinolone though. You can use that. So with the peripheral block with significant operable disc, I have found patients having a pain relief from few days to up to 6 months.
Okay.
Yeah. Recently, I will show you a video of a patient who I did about 6 months back. She was not even able to walk, but once we did that, she has all gone for Hajj, and she says these are magic injections because I am doing injections in the ankle region, and patient is having, she becomes pain free in the low back, and the radiating pain also goes.
Nice. Nice.
Yeah, are we ready?
So Mahinder, what are we waiting for here right now?
You're waiting with the drug.
Acha, the drug
Triamcinolone.
combination.
This is what? इसको भी दूर रखो. Only this. Triamcinolone. इसी में मिक्स कर दो. इसी में मिक्स कर दो. Triamcinolone दे दो.
So your thumb is actually at the superior nuchal line,
Just
or at the
below
trigger
that.
point.
Just, yeah, at the trigger point. So I would only loosely follow the landmarks here, because most important thing is always you can have a third occipital nerve, you can have a greater occipital nerve, lateral occipital nerve. So all of these things we can find, but then the trigger sometimes can also be myofascial. So we have to know which is the trigger point. In chronic cases of headache, usually because there is a free anastomosis between the lateral, the frontal and the posterior nerves, patient gets pain almost everywhere. So I have got headache patients, 24 years of daily headache, devastated life only because of headache. And we were able to give her 80% relief only with the first set of injection. But gradually they come down to the trigger point. So in such chronic cases, if you are doing an injection and you are doing a block, then initially we tell them that you have to now notice all these trigger points you know. Now you have to tell me when headache starts, from where does it start? Yeah, thank you.
Okay.
Okay. The bevel should always face the scale, yeah? So we know how much we injected. यहीं दर्द है ना आपको? है ना मीना जी? यहीं दर्द है ना आपको? ये सही जगह है? क्या अभी दर्द चला गया? चला गया? ये एम्स की कृपा है. फिर से चेक कर लेते हैं. ये वाला, ये वाला. स्पिरिट अगेन. सुई लगेगा. So I'll go to about, we'll aspirate about like to infiltrate the subcutaneous space, and I can feel a bulge going around.
So you do you touch the bone and then give it, or you just come given this?
No, no, no. I am just putting my finger on the trigger point so I don't lose it.
No, what I mean to say is that needle where you're injecting,
Yeah.
does it go right up to the bone?
Yeah, you can go to that. You go all the way to the bone, then you come back slightly.
Right, right.
Yeah. We will wait for a while. Now that.
In her case, there was only one trigger point, right?
Yeah, only one trigger point. ये हटा दो. Hmm? आपके दर्द को वहाँ पे आराम मिल रहा है? अभी कुछ फर्क पड़ रहा है कि दर्द ही नहीं हो रहा है? हम्म. एक आपको यहाँ पर लगाएंगे, ठीक है? So you go where the two metatarsals meet, you go more on the index finger side.
Right.
Okay.
Right.
Yeah.
How deep?
But here you have to go around up to 0.75 or half of the needle, because you have to go almost to the metatarsal.
Again, you touch bone here? No.
No, here we don't touch bone. And here it has to be diluted xylocaine.
Can you again just say the entry point?
It's very rough. There is no fixed point here. You just go there, because the idea is wherever the two metatarsals meet, on the medial side of the second metatarsal, you have to go here.
Okay. And here you are just giving pure xylocaine.
Pure, yeah, diluted xylocaine, not only xylocaine, but diluted xylocaine does the good job here. Because right now patient is in a certain psyche that she anyways feel, just because of touch, that there is.
Sorry?
She says that anyways, even before injection, she was pain free.
She had got relief.
Yeah.
That's
Just
a
by
sign of
touch.
a good doctor. ठीक है. Any questions
Yeah.
for occipital nerve block and peripheral nerve block?
Although I am going to cover into my presentation,
yes,
which is at
we
4,
look forward
so
to
we
that.
are going at length with the
Yes, yes.
headache blocks, even the peripheral blocks.
Thank you,
So,
Dr. Mahinder.
yeah.
That was
Thank you.
excellent. Thank you so much. So, OT बंद करवा दो.
कैसा लग रहा है अभी?